Doctors admit link between transgender hormone therapy and cancer in leaked emails. I'm going to read through the story. This is from the Telegraph. This is a prominent publication, but I'm surprised to see this, and I think it needs to be reported on because, of course, it's a major issue affecting the United States as well as Europe. I want to point out that many Scandinavian countries have halted the process by which they're giving children gender-affirming care, the left calls it, child sex change, surgery, and hormones. And these stories, this information that's coming out is actually fairly damning. I want to make this really simple to start this segment off. A lot of people on the left will say, why do you care so much? Look, I'm going to make it really simple for you. I want kids to grow up to be healthy and happy. I don't want them to be depressed and taking their own lives. According to the research we have today, desistance rates, this is not detransition, desistance is different. They could be as high as 95%, ranging between, I think, like 65 and 95. And not the exact numbers, but around that high. 95%. What desistance means is if there's a child who is exhibiting gender dysphoric symptoms, by the time they go through puberty, it's gone. And that means that non-intervention has the highest probability of success in helping these kids. That's right, non-intervention, puberty. What happens then is we see that suicide rates for trans people could be from 30 to 40 some odd percent. If we are looking at a potential 65, let's just say it's 65% chance to prevent an escalation in suicidality, then non-intervention appears to make the most sense. But I'm not a doctor. Let me read the story for you from the Telegraph, telegraph.co.uk. Doctors on a leading transgender healthcare body have admitted that patients have developed cancer owing to the effects of hormone treatment. Leaked emails show other medical professionals admitting that trans patients do not always understand the consequences of gender reassignment. The cache of files from the World Professional Association for Transgender Health, WPATH, which sets guidelines that have influenced NHS, that's in London, show that doctors are carrying out life-changing surgery and prescribing puberty blockers even though they are aware the adults and children may not fully understand the long-term ramifications. One doctor talked about a trans person who died of cancer as a result of his hormone treatment. When they say his, I think they were referring to a biological female. Quote, I have one transition friend colleague who, after about 8 to 10 years of testosterone, developed hepatocarcinoma, I'm probably pronouncing it wrong, a form of liver cancer. The doctor wrote, to the best of my knowledge, it was linked to his hormone treatment. It was so advanced that he opted for palliative care and died a couple of months later. Jeez. It is not clear from the documents if the person who died was made aware or knew about the side effect. Another said that they would go ahead with a double mastectomy on a 16-year-old girl, even though hormones had likely given her liver cancer. The oncologist and surgeon both have indicated that the likely offending agents are the hormones. We are prepared to support the patient in any way we can, e.g. top surgery when medically stable. A gender therapist said they had only turned one person down for treatment in 15 years. Quote, I have also intervened on behalf of people who have been diagnosed with major depressive disorder, complex post-traumatic stress disorder, homeless, and got at least an orchiectomy, testicle removal, they said. In the last 15 years, I had to regrettably decline writing only one letter, mainly because the person evaluated was in active psychosis and hallucinated during the assessment session. Other than that, nothing. Everyone got their assessment letter, insurance approval, and are living presumably happily ever after. A number of doctors admitted that the patients often did not understand the ramifications of hormone treatment or surgery, such as developing facial hair. A child psychologist said in a leaked email featured in the report, it is out of their developmental range to understand the extent to which some of these medical interventions are impacting them. They'll say they understand, but then they'll say something else that makes you think, oh, they didn't really understand that they're going to have facial hair. The contents of the forum was leaked to Michael Schellenberger, a U.S. writer and journalist. The WPATH files show that what is called gender medicine is neither science nor medicine, he said. The experiments are not randomized, double-blind, or controlled. It's not medicine since the first rule is to do no harm. All that requires informed consent, requires informed consent. Activist members of WPATH know that the so-called gender-affirming care they provide can result in lifelong complications and sterility, and that their patients do not understand the implications, such as loss of sexual function and the ability to experience orgasm. Wow. These leaked files show overwhelming evidence that the professionals within WPATH know they are not getting consent from children, adolescents, and vulnerable adults or their caregivers. WPATH is made up of doctors, psychologists, therapists, activists, and although it has some UK members in it based in the US, it is best known for standards of care guidelines, which the NHS in England was previously aligned with. Scotland still is. WPATH was approached for comment. The one thing I hear about quite often is actually really interesting. When we learn that these hormone therapies and puberty blockers could result in a loss of sexual function, you get these activists going on Twitter being like, why are you so obsessed with a child having the ability to have sexual function? You creep, you pedo, et cetera, et cetera. And my response is simply for the same reason we're concerned about female genital mutilation. Not that we're concerned that children would be doing these things, but that when they become adults, they may be negatively impacted. There are many activists who were victims of female genital mutilation practiced in Islamic countries who have come forward as adults and say it has harmed them and harmed their lives. I think that's important to point out that people are suffering and they're saying, hey, we should consider this. There are many people who have detransitioned, meaning that when they were young, they were told to undergo these therapies and these treatments only to realize it was a mistake. And now their bodies have been irreversibly damaged. An interesting point here is how they say some people these children don't realize they will have facial hair. There is one very unfortunate detransitioner who is female, is now morbidly obese, bald, and having facial hair. These individuals are depressed and they're very upset. I am deeply concerned that these people may be prone to self-harm. And therein lies the main challenge here. Let's talk about what we're trying to accomplish. Do I hate trans people? Of course not. I have friends who are trans. I really don't care if you want to live your life. If you want to split your tongue, get ear piercings, if you want to get implants, a lot of people get a lot of surgeries for a lot of reasons. I do hope that people get therapy, regardless of what modification they want to make, to truly understand if it's the right thing for you. That is to say, some people want breast implants. Maybe you should talk to a therapist. And I'm not saying something wrong with you. I'm saying analyze these feelings that you're having and ask yourself why you want to undergo this. Maybe you do. Fine. By all means, do whatever you want to do. The issue I'm concerned with is I believe that child transition surgeries and medical care, by the math, clearly shows that these practices will increase the rate of suicide, depression, and self-harm. That is evidenced by the high rate of suicide that is cited often by, say, Jack Dorsey, for instance. In that debate I had with Jack Dorsey on Joe Rogan Experience, he mentioned that, the suicide rate for trans people is very high, so we're trying to protect them to reduce that. And I pointed out, what about body dysmorphic disorder? People want to cut their hands off. You don't protect them. But he's got a good point. There is a high suicide rate for trans people. Okay. If children typically desist through puberty, meaning they simply stop being trans, even like take a child who says they're trans, do nothing. Once they go through puberty, they have an upwards of 90+% chance they will just align with their bodies and be happy with who they are. If that's the case, why take the risk of increasing suicidal ideation? Because when we talk about the rate of suicide being so high, understand that's just people who actually commit suicide. There are many people who are suffering and are saved. Someone will intervene and stop them. They may have attempted it and someone saved them. We do not want to see an increase in suicide rates among people. This is the scary reality of what we're seeing. A financial incentive, manipulation, activists shutting down scientific studies. And it's worrying to me why there is this big push to engage in practices that will sterilize. I was using Google Gemini and I asked it, are puberty blockers reversible? And it says yes. And I said, you are wrong. And it responded with, I apologize. While many people do believe that puberty blockers are reversible, they do have profound long-term effects, such as, goes on to mention bone density, kneecaps, vision development, and sterility as being irreversible consequences to puberty blockers. Why then would anyone advocate for these things with that risk? I suppose you can take a look at the risk of side effects versus the risk of suicidality, but then we can look at the desistance rates and see that kids typically desist. They don't detransition. If they never transition, they simply just align with their bodies and find happiness. This story is terrifying. Absolutely terrifying. But I'll leave it there. Next segment's coming up at 4 p.m. on this channel. Thanks for hanging out, and I'll see you all then.